Hi, welcome to Doc Talk. Doc Talk is the podcast put out by the Knoxville Academy of Medicine that talks about healthcare issues that impact all of us in plain language. I'm Elise Denaney, former president of the Knoxville Academy of Medicine, and I'm so glad that you are here joining us today to welcome Dr. David Harrell, who works with Premier Surgery Associates, and we're going to talk about an issue that is very, very, very prevalent in our community. It's called Gerd. That's Dr. Talk, Gerd, right?
Yes, and thank you, Elise.
Welcome.
Appreciate
Nice to
it.
see
Thank
you.
you so much.
Okay, Dr. Talk. So what's Gerd?
Well, Gerd is, it stands for gastroesophageal reflux disease, but most people know it as heartburn or just reflux. And sour stomach is also another name that I hear patients use.
Causes all sorts of symptoms.
It can be bad.
Yeah. Some people come and they say, I have burning up and down my chest here, and I know it comes on after I eat too much pizza. Some people have just a cough. Some people, like you said, have that sour belching.
Sour belches, or I think probably in the most easy, or in the first instance of it, it may just be a heartburn after you eat a big meal and you feel like you're having a heart attack and there's some burning. It can get to where it's happening all the time or daily, and in that case then it gets usually brought into the doctor's office for an evaluation.
Yeah, that's horrible. You can't concentrate on your work if you have pain here. Yeah. So they have those symptoms. They go to the doctor. Doctor says you probably have Gerd. What do we treat it with?
Usually, and probably this is when the patients have already tried Rolaids or Tums or Pepto-Bismol or Mylanta or Maalox, over-the-counter things. And also, there's some pills you can take over the counter. Pepsids, these are called H2 blockers. Basically, they decrease the stomach acid production. Or PPIs, which is like omeprazole or Prilosec or Nexium. There's several brand names, but basically those all decrease the acid production by the stomach.
I see a lot, they're very popular to take over the counter, and I think it's great because then it takes care of the symptoms and your quality of life is restored. But you don't want to be on those forever, right?
Right, and I think we're just finding out that in the short term, just for maybe a few weeks or a few months or even a few years, there's probably minimal side effects. But when you start taking them year after year after year after year and you become dependent on them, over time it can cause some problems. And some people can even have decreased bone structure, osteoporosis,
Right.
then brittle bones,
Yeah,
and also Alzheimer's.
right, dementia.
There
Yeah.
can even be some gastric polyps that
Okay.
develop from overuse, and it can also affect the bacteria in the intestine downstream too, so make you more susceptible to bad infections.
Yeah, because it's interesting. The stomach produces acid. That's its purpose.
Right.
Because it breaks down food and it gets rid of the bad stuff. That's why we're supposed to wash everything we eat. But I'm going to take an apple off a tree and brush it on my shirt and take a bite. So yeah, it's going to decontaminate some food that I haven't done a good job of decontaminating. So when I take the medicine, I've kind of lost that.
Right, and it helps to digest.
Right.
The acid is there for a reason. So it's meant to help digest the food, kill the bacteria, and make it easier for us to break down the food we need to eat to live. And the problem is when it goes from where it's supposed to be up into the chest. And that's where it causes pain and problems, the burning.
Yeah. Now, okay, so we're talking plain old mechanics. So my stomach's here, the esophagus is here, and this is where I'm having pain. So I suspect if I increase pressure on my stomach, it's going to push it up.
Exactly.
Okay, so like if I have a beer belly, is that going to make it worse?
Yes, there's just more pressure
Or if I'm pregnant.
on the stomach when you're pregnant.
Yeah.
Also, a lot of times ladies don't always realize, when they have those, especially short-waisted ladies, and they have a really tight belt line.
Oh, right,
And
right.
when they bend over, it's almost like a squeezing effect on the upper part of their abdomen. So that can squeeze the stomach up into the chest and make the heartburn worse.
Interesting.
So that can be, because we all like to have a thinning waistline, and that's normal, but if your clothing is too tight, it can also cause worsening heartburn.
Okay, so maybe even before we go down that road of taking medicine, losing weight might be an option to treat GERD,
Yes.
but that's really hard.
It is hard, and we just mentioned it beforehand. I had a lot of heartburn, and I lost 30 pounds over
That's
about
amazing.
a year, and the heartburn went away. So that would definitely be your first and best option to help the symptoms.
I still think that takes a lot of willpower.
It does. It does. It's tough, but it does help. And then typically the patients usually, if they keep having trouble, or I guess as an ear, nose, and throat physician, you see a lot of the throat and hoarseness symptoms.
Yeah, sometimes gastroesophageal reflux disease manifests itself, or I see it when they call it silent reflux.
Right.
Because they don't have the burning here.
Right.
But that same lower pH acidic environment goes into the back of your throat and where your tongue, the base of your tongue is and everything, and it tickles back there, so you're coughing. You just kind of
throat clearing.
All the time, right. And some particularly acidic people, not that they're bad, but they're particularly acidic, they can have sinus disease, they can have a chronic sore throat, they can get fluid in their ears if it's really, really, really bad. So that, yeah.
Dentition.
And dentition, yep. And so yep, so diet, exercise, judicial use of medicine, and then they get to see you.
That's right. And the other thing is, a lot of times people that have the asthma and coughing symptoms, when the pulmonologist has tried everything and they've had lung testing, and it could be that heartburn acid going down the wrong pipe, causing the lung symptoms. So those are all sort of atypical symptoms, but things that you don't always associate with reflux.
Yeah, but very relevant. So sometimes when persons have reflux disease, they'll get esophagitis, which is that chronic irritation of the esophageal lining that you mentioned, and itis meaning inflammation, so they'll get inflammation of their esophagus, which is not chronically over time not a very good thing, right?
That's right. I think the medicines are fantastic, and they really help in the short run. Mm-hmm. And the problem is, over time, if you take them for years and years and years, not only can it cause some of the Alzheimer's and the brittle bones, but sometimes the lining of the esophagus can get damaged. And it's a precancerous lesion. People with chronic heartburn have 8 times the higher likelihood of getting esophageal cancer. So that's where it's life or death. It's not just something that wakes me up at night.
Yeah.
It's something that could actually kill me.
Right. It does require judicial attention. One of the things that you do if a person doesn't have a good clinical response to H2 blockers or to PPIs, over-the-counter antacids, is something called a Nissen fundoplication. That's a very technical term. What is that?
Yes, and this is sort of, and I like to give hope to the patients because sometimes they've been on the medicines and the pills for years, and it's just not getting better and it's getting worse, and they've not really been given a lot of options. And what we can do is actually surgically, and I do a lot of these, sometimes 1 or 2 a week, with robotics. So these are the little Band-Aid cuts, the little keyholes. We go in and basically pull the stomach back down from the chest. If you have a hiatal hernia, we basically replace it where it's supposed to be. We close the hole and then wrap the stomach around the swallowing tube. So basically it's kind of creating recreating the one-way valve that was supposed to be there, that was there since birth, so that food goes down but not back up.
It's fabulous. I love that idea because it's not cutting anything. It's just kind of using the own natural tissue to reinforce.
That's right. Nothing is cut out. It's just basically the stomach's repositioned where it's supposed to be, and the valve is created with your own tissue. So that essentially, it's like a flapper. It's plumbing. It's a plumbing problem, mechanical. So you eat, and then it's like a nipple valve or a flapper, so the food goes down, and then it doesn't come back up. It stays put, so you don't get all that acid coming up. And most people, probably usually about 90% of people can get off their medicines, and it's a 90% 10-year success. It's not 100%, but the stomach is just like a trash compactor, always moving. The lungs go up and down about 20,000 times a day, every breath.
Right.
And so with all that movement, sometimes these things can shift.
Right.
But
it's amazing it goes 10 years.
That's the statistic.
Beats my washing machine.
It's right. It's better. That's right.
Yeah, I think that's amazing. And I love the fact with minimally invasive surgery now, you don't need a zipper cut on the abdomen, but it's, like you said, a Band-Aid cut. And we should talk about robotic surgery one day because you insert an instrument and then it has this little thing at the end and it just twirls and it goes in all different directions.
Exactly.
Yeah.
It's like I'm a little leprechaun being lowered down inside, and I can tie and cut and sew and just operate like I was down there, and so it's beautiful. I mean, I think it's a good tool because I can see better, sew better, and
recovery, I'm sure, is much better.
You do stay overnight. Typically, there's about a 2-week period where you're on more, I don't want to say baby foods, but things that are in a blender. Soft foods, mashed potatoes,
Right.
milkshakes, smoothies, just until the swelling goes down.
Right.
Then you're back to your regular eating, and you can get back to some of the foods you probably miss.
Well, I wouldn't want to swallow something too big. What if I stretched the stitch and it popped?
Well, it always stretches, so it needs to be able to stretch.
Okay. All right. What is, because I see this all the time, what's a hiatal hernia?
That's a great question, because sometimes people call it out there in the community a high hernia. It's not really a high hernia, it's a hiatal. But basically, the high hernia or the hiatal hernia is where the stomach has actually gone up into the chest a little bit, or a lot. And it's just like a hernia in the groin or in the navel, except you cannot see it. You can find it on x-ray, and it makes your heartburn worse. So a lot of times the heartburn will be associated with a hiatal hernia.
Gotcha.
And in that situation, that valve that we're all born with won't work, because in order for it to work, it has to be down in the stomach where the pressure is higher. If it's up in the chest, there's suction, and so it just essentially, it's like a siphon. Yeah, the acid comes right back up. So it makes the heartburn worse.
Okay. And that procedure we talked about, that Nissen fundoplication will actually help with that because you're pulling the stomach back down through the diaphragm.
Right, exactly. That's the first part of it. You would free up the stomach, bring it down to where it's supposed to go. You would close the hole, which is the hernia, in the muscle, and then you would wrap the stomach. And I usually, and Nissen is the kind of the old, it's the common term. Actually, I don't use the complete Nissen anymore because it's a complete wrap. So some patients get a little bit of bloating.
Okay.
So now we kind of just go partial. It's called a tope. Not this kind of tope. But it's just a partial wrap, so
Okay.
they don't get the bloating.
Okay.
And that's, some people have been afraid of Nissens because of bloating. So I don't use those anymore. But it is a fundoplication.
Okay.
So it's a little better, I think.
Okay. So that's great to know, because as we continually improve on our surgical procedures, we improve in the sense that the outcomes are better and there's less complications. Yeah, which is great. So thank you for telling us about Gerd, hiatal hernia, high hernias, the surgical procedure, Nissen fundoplication. And if we have more questions, how do we get a hold of you?
Well, thank you for asking. Our office is at 938-8121, and we're located in Powell, behind the hospital.
On Connor Road.
Connor Road, that's right.
So that's up in Powell off of Emory Road.
That's right. And I'm also seeing patients at our paper mill office between McKay's and the Holiday Inn.
McKay's is pretty much a landmark, isn't it?
Yes, everybody knows where McKay's is.
McKay's is great. Thank you so much for joining us today.
Oh, thank you. Thanks for having me.
Okay, that's a wrap, and hopefully we'll see you later on for the next podcast. Thank you.